Everyone, welcome back to another episode of Raising Good Parents. I am very excited today. I get to talk to somebody that I have been stalking on Twitter for ages. She is a author. She's a pediatric ear, nose, and throat doctor. She's written a lot of books and is very active in teaching and educating the public about all things health and health related to kids and families, and focusing on what actually works. Dr. Nina Shapiro is with me today. She is the head of pediatric otolaryngology, which is ear, nose, and throat doctors at UCLA, and she has written several books. She has a new book coming out this fall in October for kids about their health and all the different things like screen time and food choices and all of those different things. And today we're talking about her book that is already out and is called Hype. And it's all about the stuff that gets hyped in the medical world and how to figure out what's true and what's not true and where to spend your time and energy and focus and money from a health perspective. And it's coming out in paperback right now, which is super exciting as well. So thank you so much for joining us, Dr. Shapiro. I would love to hear a little bit about what it's been like with Hype coming out and then COVID coming out, because there's been a little bit of an uptick in medical misinformation in the past year, and your book is all about medical misinformation. So, I mean, it seems like they go together well. But what has your experience been like, I guess, dealing with medical misinformation since the pandemic started or since your book came out?
So medical misinformation is unfortunately as old as medical information. But we've really, as everyone knows, had a sort of huge uptick in medical information pretty much as soon as we heard the term coronavirus. We weren't calling it COVID initially, but coronavirus, SARS-CoV-2. As soon as that diagnosis was sort of buzzing around back in late December 2019, January 2020, we were just hearing about it. As soon as that came to be, then the hype of this virus really exploded. Very briefly, back in February of 2020, all of many alternative medicine, healthcare, wellness sites started selling products to prevent COVID-19. So something like silver, ingesting colloidal silver, inhaling silver, using special teas, high dose vitamin C. And a lot of this gets mixed with some real medicine. So vitamin C, for instance, or using vitamin D, high dose supplementation. There is some value to some of these supplements for viral infections, especially COVID-19. But what happens in the media and what happens on sites that are selling products is they explode this into something far more than just the basics. And it's quite destructive. It's very seductive, and people are desperate, and it is pulling people in to down these rabbit holes. And it's certainly a waste of money, and it's potentially harmful as well.
Well, and I think you nailed it on the head, really, because they are seductive, and it's like there's so much uncertainty. If I buy such and such product and devote my time to spending money and learning about this very specific thing, then maybe I will be safer, and that's all I've got to bank on right now. And so it can be really hard to get pulled down that rabbit hole and then figure out how to get back out of it. And you talk in Hype a lot about kind of where to get good information and how to avoid misinformation. So I would direct listeners to your book to kind of learn about that, because that's something that we deal with in the pediatric realm on a frequent basis. Are there any specific things within the book Hype that really lend themselves to the pediatric population, or things that you have really enjoyed talking with patients and families out from an ear, nose, and throat perspective?
Sure. So, nowadays most adults are desperate, or hopefully most adults are desperate to get a COVID vaccine. But prior to this past year, vaccine issues were about children. And, yes, adults do need to get some vaccines, annual flu
Right.
vaccine, vaccines if you travel. But in general, vaccines are a pediatric issue. And I have several, I have a chapter and then several areas and several other chapters where I discuss vaccine hesitancy and resistance and concerns So that comes up in my practice in ear, nose, and throat because some of these vaccines, the pneumonia vaccine or Prevnar, can reduce incidence of otitis media. Some people, recommend boosters. The pneumococcal vaccine will
Right.
reduce illnesses in children. So vaccine issues do come up in my practice. So that's been an issue that I discuss with parents very, very freely and very comfortably. And the other issue is, how, remedies for ear infections. I'm sure you've heard many yourself.
Yeah.
Um, so, that's
That's a really good one. I would love to talk about some of the things that you hear that they tried for ear infections that didn't work. I mean, things that I hear on a regular basis. Well, first of all, people think that like getting bathwater in the ear leads to the ear infection, which I try and reassure them like it's okay that they're splashing in the tub or that they go underwater, that doesn't
right.
cause ear infections in the way that we think of an acute otitis media. Maybe swimming in a swimming pool on a regular basis, you can get otitis externa.
Right.
What are some of the things that you hear on a regular basis related to ear infection treatment or prevention, or things that don't have any science or evidence behind them anymore?
So one of them that's probably the most common, that's a little bit of soft science or extremely soft science, is cutting out dairy will
Yes.
will reduce ear infections. So, and there is some evidence, certainly if your child has significant, dairy allergy or lactose intolerance, that's something I always recommend to discuss with their primary doctor to see if there's really a reason to reduce dairy. But other than that, dairy is not the root of all evil in my eyes. It's quite healthy for you, especially for young children. What
Sure.
I do recommend is that, a child should not take a bottle or a sippy cup of milk to bed at night, which many children still do. That's bad in so many ways. Ear
Sure.
infection, least of it. But I hear a lot about dairy reducing ear infections, which is not necessarily the case. I also hear about oil drops that parents
Yes.
put oil drops in the ear. And then I really just very clearly say, this is your ear canal. It's a piece of skin. And so is the eardrum. It's a piece of skin. And so drops are not going to do anything from the outside. This is all coming from the inside. So then sometimes they ask, well, should I put the oil drops in the nose? Which is a reasonable question, but the answer is still no. This year of COVID, and I would assume this is the case in many pediatric practices, we have seen the lowest incidence of otitis media, recurrent otitis media, middle ear effusions in decades.
Amen.
Decades.
Totally. Yep.
Yeah.
I honestly,
Very.
I sometimes have to like remember the dosing for amoxicillin and septenia or something like that, because it's so infrequent that I see a child get an ear infection these days compared to a year ago and 2 years ago and 3 years ago. It's just it's almost like it's like the rare bird of an actual bacterial pneumonia. Now I
Right.
rarely ever see that. 50 years ago, that was every third patient had bacterial pneumonia, and now nobody has ear infections either.
Right, right. Which is, it's a silver lining. They'll be back. I'm starting to see, some of the younger toddlers, the kids under 2, where they don't have to wear a mask in daycare, and they're getting back into daycare in groups. I'm starting to see a few, but it's been a handful. It's interesting.
Right. And so the oils in the ears don't work. I mean, one other thing that I see on a regular basis in the ear world is every parent thinks their child has more earwax than anyone else in the world. And every day I have to be like, no, no, no. Everyone has that much earwax. It's not a big deal. Earwax is normal and healthy. And you don't want to go trying to dig it out and those sorts of things. So that's another common ear issue that I see that
Yeah.
comes up that I
Yes.
try and
They're-
redirect them on.
And parents get really embarrassed. They're like, "I'm sorry, I didn't clean their ears. They're dirty. There's wax." I said, "No, no, no. Wax is protective. It's good, and it's not dirt. And leave it alone."
Yes,
Yeah,
that's what
grow
I have
up.
to reassure people all the time. I think that is a commonplace. I think the washing behind the ears sort of deal, really inspired people to really worry that if their child's ears aren't clean, that it's a underlying, signal that they are an
Right,
unclean child or something like that.
right. All child services, right? Yeah.
So there's a lot of issues in pediatrics, and there's a lot of issues in the adult world, and with misinformation. And it seems that the internet has only made it all the more difficult to handle and deal with. And I think there's a lot of parents out there that see this misinformation and are trying to just like sift through How do I know what's true? How do I know what my sister-in-law is forwarding me these Facebook articles about? How do I know if that what I'm seeing from such and such person on television is the truth? It's so hard to figure out like where to get information from. So, do you have any recommendations for those that are like, I want to do what's right. I understand that there's evidence-based medicine, and then there's medicine that's not evidence-based, that's either anecdotal or made up or intended to try and seduce you into purchasing something. How do parents and just the adult lay people work through that and find good information that they can use to better educate themselves and the people around them?
It's getting more and more challenging, because what happens is if you put something on your computer or your phone, a topic, you will be fed these mostly false articles. They'll just automatically filter into your feeds. So it's, unfortunately, even if you're not looking for it, it comes to you now. It's
Right.
quite terrifying. What I recommend is, excellent. There are excellent news sources that oftentimes or can provide really inaccurate information, and vice versa. There's some crazy stuff out there, but there's some truth to it. So what I recommend is, you take that extra 3 minutes, and whatever article you're getting, if there is not a link to a primary source, meaning an academic, boring looking article, then take it with a grain of salt. And when you get to that article, and you should be able to access it, if you don't have an academic computer site, you can use Google Scholar, which is available to everybody, and just read the abstract. You don't have to read the whole article. You don't have to have a scientific background to read a 2-paragraph summary of an article. And there's your information. And then you can see that it was 3 patients, not 30,000 patients,
Right.
or it was over a period of 2 weeks as opposed to 2 years. And then it's pretty simple. And if you keep doing this on a regular basis, you can decipher, not necessarily that things are wrong, because oftentimes it's not that it's wrong or it's right, because as we've known over this past year, especially, nothing is absolute in medicine and science. Nothing
Right.
is the final word, but it gives you some perspective as an educated person making educated decisions. If you can just take that extra time, look at the article. If there is no article, then I think you've answered your question. It's not a
I,
valid piece of information.
I think that's a really good point, and I think that one thing that people get stuck on is like a Facebook post, for example. If there's
Yes.
no source even to go from, and it's just somebody that's saying this, that, and the other thing, then some physicians tell their patients, don't Google your symptoms, whatever you do, and I think I take more of the approach that you suggest, which is to be an educated Googler of your symptoms, which means you look at a couple different articles. You don't just take one person's word or an experience that they had and extrapolate that to everybody. And then you look for primary sources. And that doesn't mean you have to go read through papers or get a statistics diploma or something like that, but to look at where they're getting their information from. And are other people that are respected in the field saying a similar thing or a different thing? Because there certainly is a wide margin of evidence-based medicine. It doesn't mean you have to do everything a very specific way. There's certainly gray. It's not just black and white. This is right. This is wrong. But if it's just one person, if it's just an anecdote, if it's just something that they wrote on a Facebook post or a Twitter tweet or something along those lines, then see if there's others that agree with them, or if they're standing alone as the only person saying that, or they don't have any evidence to go along with that.
Right. And also, I think we also have to get comfortable with knowing that even these really solid articles, um, you know, the, there's going to be more research. And so, the data is ever changing, and, we have to be able to tolerate that and not necessarily hold everything as gospel and this is it. And that's the be all end all. But,
Right.
I think people feel that they have to take in what they read as this is what it is. And, the thing about Facebook or Twitter or, any of the social media sites that people use, or even just texts from friends, is it's very sensationalized. It's always going to be a tear jerker, whether it's, for good or bad. These little videos that people create are very, very clever and beautiful, but not necessarily accurate.
Right.
Or, may just involve one person. So, you really have to take that very lightly and really almost as entertainment.
I find myself sometimes having to like step back and say, well, is this what I really think is going on? Or is this several different things that happen simultaneously or one after the other that are probably unrelated? Or am I thinking this way because I saw an article and now my brain is predisposed
Right,
to
right.
react to that information like that? And would I have had those same thoughts had I not seen that article yesterday that kind of primed my brain to recognize these patterns that might not exist? And that's a hard thing. That's a hard thing to combat in your own mind, and trying to convince other people is really difficult
Yeah.
when it's firmly held beliefs. It's something that you might be hanging your pride or your reputation or your integrity on. It can be really hard to be told you're wrong, or here's some evidence that refutes what you just wrote on Facebook. Do you have any suggestions for people that are trying to change the mind of someone else, whether it be a loved one? I mean, I just tell people not to waste their time with Facebook comments and like trying to undo those, because you really can't unravel that. But somebody that they love, somebody that they care about, that they're trying to have an open, honest conversation with, do you have any suggestions on how they can better frame their discussion that leads to that conversion of heart and mind?
That's one of the hardest things, is to change somebody's, change your medical mind, or just change your
Right.
mind in general, or change your mindset. So what I try to do, and this goes really for parents and for children, when we're having a conversation, is to really try to tease out what it is that they're, let's say, concerned about, or what they don't believe, as opposed to just saying, for instance, people nowadays, I don't want to get the COVID vaccine. Okay, what is it about it that you are resistant to? And that way, if it's something specific, then, and it usually is, then you can address the issues one by one, as opposed to like, oh, what are you talking about? We can't get back to life until everybody gets the vaccine. You have to get it.
Right.
Don't be stupid. That's not going to be productive, and actually could be destructive. So when it's with anything, whether it's for, medications or a diagnosis, or parents are convinced that their child has something where and they don't, or again for vaccines, I really try to break it down, and that way we can discuss each of the issues. And oftentimes I found, especially currently with the COVID vaccine, once each of the issues are addressed, people do feel much better about making a good decision and going to get it. So for instance, if it's a woman and they're concerned about, they've heard somewhere that it interferes with fertility or
Right.
pregnancy, we can talk about that issue on a very, very appropriate, depending on the patient's level of education, what the issues are with this concern, how that concern came to be, what the OBGYNs are saying, and really just sort of break that down to address that specifically. So in general, that's what I do. It's very challenging because, just as we have our set ways of believing, and I hate to use that word because it's not the Easter bunny,
Right.
but in what we just, are able to analyze from an evidence-based standpoint. And we as doctors have changed practices. Our practice, antibiotic use is a perfect example. Using it
Right.
much less has really been quite beneficial. So I think that over the years we've changed, and I think adults and children can change as well.
I think that is, I mean, so wise what you said there about really breaking it down into the components of the decision that they've come to. I'm not going to get the COVID vaccine. My child must have an antibiotic. We only eat non GMO foods. If you just say, well, that's stupid, or, some version of that, like, here's a bunch of papers that tell you that you're wrong, well, my pride is injured. And this is something that I firmly believe. And if you just tell me I'm stupid, then all I'm going to do is think, well, I can't share that information and I have to go underground, or I have to seek out additional people to support me in that decision. And then you get even more entrenched and it's much harder. But if instead you come from it from a place of, I want to understand why you feel that way, because perhaps I have some information that could help you change your mind. So if you can explain to me, oh, it's because of your concern over fertility and you're trying to get pregnant and it's been hard. I'm sure that's really confusing to be in this place where you're seeing that on Facebook about the fertility, question with the COVID vaccine, or you're unsure, about, giving your child an antibiotic because what if something bad happens to them because of that? If you can break it down into those components, you can say, I can understand why you would feel that way because there's a lot of misinformation out there. From what I have read and from my understanding and from what I've been telling other patients is that here's what we know, here's what we don't know, and here's why I think it's a safe idea to do this, or here's why I think that we should wait and acquire more information, or something along those lines, where you're kind of bridging that gap and maybe helping them cross the bridge, but you're not, just either pushing them out across the bridge and letting them sink or swim, or just, cutting the ropes and saying sayonara because they're on the wrong side of the bridge. I'm getting deep into this bridge analogy, and I want to abandon it because I don't think it's that great of an analogy. But I think that what you've said there is so wise, that if you can show them that you understand, or that you just care enough to ask why, rather than just shut them off or say, well, that's dumb or stupid, or why can't you just get on board? People are people. They want to be understood before they change their minds or come around to something that you are trying to convince them of.
Right. And I think actually that goes for children too. I'm sure in your practice, but definitely in my practice, I get a lot of I'm scared.
Right.
And, the answer to that shouldn't be don't be scared,
Right.
because they're scared. You can't tell somebody how to feel. So, what I like to do, and again, this is primarily in children who are either being scheduled for surgery or about to have surgery, the first question I ask is, what are you scared about? And it's usually a very, sometimes they have a list, and we'll go over point by point depending on the age of the child, and it's very age dependent on what
Sure.
children are scared of, certainly when it comes to surgery and anesthesia. And we just go over point by point, and it's usually the same concerns that they have. And even if I can't allay all of their fears or their scaredness, at least we can address it and discuss it and sort of empower them to know, yes, you're going to have a sore throat. You've had sore throats before. We'll give you ice cream or popsicles, not to pretend that it's not going to happen,
Right.
not to say it's not going to hurt or it's not, going to be a little bit scary, but, sort of to embrace that feeling. I think that goes for adults too, because a lot of adults have concerns that they don't necessarily know what's in store for them, and I feel like if they do, they feel a lot more in control.
Oh, for sure. I think that that's one thing. I just had two recent Instagram posts on that exact sort of thing. Like, when your child demands something, the worst thing to do is just shut them down or try and distract them with something else that's shiny. Instead, just say, oh, what would it be like to watch another episode of Paw Patrol? Who's your favorite character on Paw Patrol? Or
Right.
it would be cool to have a unicorn. I want a unicorn too. Do you know where we can find one? We'll have to look around. Like, if you can do that instead of just like shutting them down, then they'll open up. And that's often enough. You don't have to solve their problems. You don't have to solve the person that is questioning whether they should get the COVID vaccine. Once you show understanding and kind of help them with that information, then they can make the decision for themselves. And you've done everything that you can to try and provide that information. And same with if they're scared about going into surgery. Well, I get that you're scared. I would be scared too, probably. I bet you're scared about this, and this. Is that what you're scared about? Oh no, you're just scared that your stuffed animal is going to get lost because we had to put it over there. Well, let's just put it on your bed with you. Like, it might be that you're totally off base in why you
Yeah.
think that they are against whatever they're telling you they're against.
Right. Yeah. And it's usually they feel so much better. And I think that, there have been some studies looking at, how, if you can allay a child's anxiety prior to an anxiety producing event, they will have a better outcome. medical outcome,
Right.
actually. Yeah.
Well, before we wrap up, I want to do just a little rapid fire hype things. So
Okay.
you tell me if this is healthy or not necessary. Um, Avoiding genetically modified foods.
That is hype. So a little
That is
genetic,
hype.
yes, so a little genetic modification can be good for us. Especially if it's something where, it's genetically modified to reduce the need for pesticides is a perfect
Sure.
example, I think, or to increase the vitamin content of fruits or vegetables. It actually makes it healthier and safer. So genetic modification gets a really bad rap. So that's hype.
And that's something that we've been doing naturally for a long time. I mean, picking the crops that we want to have more of. How about organic only foods? Do I need to only eat organic foods to be healthy?
You do not. So, as we call it, conventionally grown foods can be very healthy for you. So, it's better to have a conventionally grown fresh food as opposed to an organic, bag of chips or something like that. So,
Right.
organic is a very enticing word, and there's certainly some benefits to some organic food, but it is certainly not necessary for health. And the studies that have looked at health outcomes in people who have conventionally grown versus organic foods, there is absolutely no difference.
Okay. And then how about vitamins? Does my healthy, somewhat picky toddler need a multivitamin?
So, if you ask any dentist who, has to deal with these kids who chew on these gummy vitamins every day, and it ruins
Right.
their teeth, only ruins their teeth, but doesn't necessarily improve their health. All toddlers are picky. I
Right.
have met very few toddlers who have a very varied palate. So, if you have one of those toddlers who lives on, pasta and milk, which many of them do, they
Right.
do get a lot of vitamin. A lot of food is fortified with vitamins.
Sure.
So
Sure.
unless your child or you as an adult have an actual vitamin deficiency, which some people do, it's extraordinarily rare, except for
Sure.
some women with vitamin D deficiency. It is unnecessary to take
Okay.
supplements.
That's exactly what I tell patients too, and I haven't had any that have, it's never come back to bite me that they, were kind of a picky toddler and didn't eat all their green beans and things like that, and they had some sort of vitamin deficiency. So I agree with all of those things. So I'm glad that, my preconceived notions and my recollection and reviewing of the evidence in the past is supported by what you're saying. And I really appreciate everything you've done for pediatricians because most people wouldn't know, but I know you have a book from a bit back, 50 studies that all pediatricians need to read,
Oh,
and you do all sort of education for physicians and lay people, and I just so appreciate your time, and I'm really excited that you have Hype out right now and it's coming out in paperback, and also the book that's coming out this fall. Can you tell us a little bit about your book that's coming out this fall that's for children about their health?
sure. So the title is The Ultimate Kid's Guide to Staying Healthy. And what it will be is sections about different issues related to what kids want and why they have to do what the parents tell them to do or ask them to do. So
Okay.
it breaks down the science of what kids are desiring or what kids don't want to do. So I want to stay up later. Why can't I stay up later? Why do I need to go to sleep? So it talks to them about, sleep. To most children, sleep means doing nothing.
Right.
It's a waste of their time. And so, what happens when you sleep? What does REM sleep do? What do your dreams do? What does your heart rate do? What does your blood pressure do? All these things that happen during your sleep. I want to stay on my iPad. That's a big one, especially this
Right.
year. So what happens to your brain when you're on your iPad? Things about eating. So one of the chapters is why can't we have cookies for dinner? So I
I
give
love
them
it.
a really great healthy recipe for making chocolate chip cookies, not necessarily anything, special. There's no hidden carrot juice in it. It's just
Right.
cookies. But then it talks about what's a carbohydrate, what's a protein, what's a fat, what does it do to your body? How does your digestion work? How does your energy work? So it's geared towards sort of the 6 to 11-year old
Okay.
range, elementary school kids,
Yeah.
And it really, it has I have a great illustrator, a really fun illustrations, and just walks them through, sort of a little bit funny ways of thinking about things. Something as basic as, what is soap? What is a soap
Sure.
molecule? Why, we talked about that in COVID, that all of a sudden became soap and water was this new phenomenon. So how does soap,
Right.
why do
Oh,
we
that
tell
sounds
them
like.
to wash their hands with soap? So
I
things
mean,
like
that sounds
that.
like such a useful read because oftentimes, I mean, some parents have noticed once in a while that their kids don't necessarily listen to what they as the parents say, but if somebody else tells them that or they read it in a book, it becomes so much more, believable than when we're just told it or instructed it by our parents. So it sounds like it'll be a really useful tool for parents to show, hey, this is why we can't stay up all night and we can't play iPad all day and we need to bathe ourselves and those sorts of things. So I can't wait
Brush
for
our
that to
teeth.
come out.
Thanks.
Awesome. Well, thank you so much for your time. I will put links to Hype in the show notes so people can go to Amazon and purchase that. They can check out your website, drninashapiro.com. They can pre order your upcoming children's book and
Yes.
keep in touch with you and follow you on Twitter, which I thoroughly enjoy. So thank you so much, and thank you for all the
Thank
information that
you.
you've done. It has been a really hard year, I know, and it's hard to just keep going with everything the way it has been and the way that science has often been
Yeah.
treated. So I really appreciate you, continuing the good fight.
Well, you're doing great work. I appreciate you. I read all of your posts too. I actually saw that post about the unicorn. So
Awesome.
it's great
Well,
what you're
thank you so
doing.
much, Dr. Shapiro.
So, yes, it was a lot of fun.
Thanks for watching. Now, before you go, hit subscribe. And if you have a question, text me 402 256 0768. Keep up the good work.